do my best to run around the internet. Go ahead and grab that for you, put that link over there. I'll also include my email if you need to email me for past webinars or different things like that. Everybody kind of has an interest that'll pop up along the way. Yes, we are recording. That red light is on. We will send a shareable link to you and your team. So be sure to pass that along to maybe some peers who might find this content interesting. We would love to get this in front of them as well. All right, we are also going to have a few polls during today's presentation, so go ahead and give us 5 seconds of your time and click those polls. We'll be dropping some offers for Compassionate Finance and Abella into the chat, as well as registration for tomorrow's big webinar with Gary Takis. It's going to be a good one. But without further ado, Dr. Baird is here. How are you doing today, Dr. Baird?
We are doing good, Got few grandkids over today and going to do a little swimming and do a few more of these webinars as we go through the day. So that's what it looks like. But, you know, this is, you know, I told some people, and some of you have heard me on Facebook Live, but I went in the office this week on Monday and man, I'm just so impressed. It wasn't that big a deal. I wore the gear and I'm very hopeful that we're going to be knocking it out of the park soon. And we started back May 1st. We're at 90% of our usual production and collections, which is awesome. And one of the things we do at Productive Dentist Academy is we're working with people to try to help them in getting back to their full production, or if not higher. And that's what we're looking at. So anyway, go to the poll questions if you would, and fire that answer for us. That would be awesome. And let's get started. 5 things you must do post-corona, or as Howard Fran last week said, BC, before corona, the new normal. And what is that new normal? Longer dental visits. They're going to become the new normal. We realize that you're better off doing longer procedures, and also you're going to have longer time in between, more stringent measures to handle the sterilization that you're doing. Fewer patient visits due to longer room turnover. So it's a big issue right now with a lot of docs that are kind of tied to the PPO environment, because you know, you're going to have to really reevaluate, are these fees enough for you to run a successful business? And that's one of the things we're working at with Productive Dentist Academy, is how do we help dentists who are tied into the PPO environment? How do we get you more into a fee-for-service environment in a successful way where you're seeing less patients and higher profits? And so we're really working hard in that arena. You know, many of your patients are going to lose 30 to 40% of their retirement savings. We have seen the market come back up. Today it's up again. Monday it was up, but it's jumping all around. And my personal feeling is we're going to see a little bit of adjustment as this reality of what happened in April and May is seen. So, you know, that's just something to think about. Patients' FICO scores, they're going to drop by 60 to 80 points. Back in 2008, they dropped 40 to 50 points. Well, it's going to be higher now, no question. Conventional third-party financing, they've already announced more stringent lending rules. They're already, Synchrony Financial, who's behind Care Credit, they've said we're going to start looking at things differently, and so has the other companies that do this. Predictions, you know, of a severe contraction of the economy in the first 2 quarters of the year, perhaps lasting into Q3. They're anticipating that Q2 could be down as much as the GDP could be down as much as 35 to 40%, which is, you know, it's depression levels, but you know, it is what it is, and we're going to come out on the other side successful. You know, I believe that those patients, those that are patient, will see a fast recovery, but it'll take 2 to 3 years to recover completely. This is just, again, I'm not an accountant, I'm not a CPA, I'm not a attorney. These are just my thoughts, and I share them every day and every week. And what I know, I'll share with you. Back in 2008, I'd already gotten hit hard by the 2000 dot-com bubble, and then 2008 comes around, and we lost 50% of our retirement savings. And in my infinite wisdom, I sold everything. And if I would have held it, I would have gone up 3x over the next 7 years. So, you might not want to listen to my financial advice, but obviously it is what it is. There will be pent-up demand for services. We're seeing that already in our office. There's people who have been waiting to come in. Now they've broke a tooth. They've got a lot of pent-up demand. When you've got to be ready, not just when the crisis is over, you've got to be ready now to ramp up your business. We were ready. That's why we're at 90% of our usual production and collections. And I expect that to be up to 120% as we go through the next 6 weeks. Scheduling is going to be extremely important, and we're going to talk about that in a little bit. The cost of doing business, we mentioned that earlier, the cost of doing business is going to increase. 40 million Americans have lost their jobs and their insurance. So you're all tied to this PPO environment, many of you, but 40 million of your patients don't have insurance anymore. So what are you going to do? I mean, what is going to be your new normal? PPO practices are going to see decreasing profits due to the PPE costs and longer patient visits. I read a good article this morning where a dentist was giving his thoughts about insurance. And they said, well, insurance companies, they've been collecting premiums during this time. They really should open up what they're paying for with procedures and everything else. But if you believe insurance companies are going to do that, I've got some swampland in Arizona, I'll say you. 5 steps to recovery. Let's look at the 5 things that I think are a must. 1, prepare your team and patients ahead of time. 2, scheduling based on productivity will become the only way to schedule and ensure practice survival. And we're going to talk about that. Saying yes to same-day dentistry on emergency and hygiene patients. See new patients in the doctor's schedule. Many of you are already doing that. I'm making the recommendation that if you're not doing it, you really want to, because you're really going to want to help those patients. Be prepared for new financial arrangements and ways for patients to have treatment. So let's break it down. Step 1, prepare your team and patients ahead of time. Communicate with your team weekly on Zoom meetings. You'd want to make sure that you're communicating with them. Also, with the community, you can share with them all the new safety features for PPE you're doing. We've got a lot of docs now that are doing Facebook Lives in their communities with all their friends and patients. That's actually bringing them new patients from people on Facebook that didn't know, that didn't maybe have a dentist home. So they're actually out there doing live Facebooks and telling everybody, walking through the office, showing them all the new safety features for the PPE. Use the PDA document, Reigniting Success. You're actually going to get that today. But I just want to go through it for a second and just show you kind of what it is. This is, to me, one of the best documents that's been put together, and we've had it now for about a week and a half. But let's just look down and see. We go through an introduction, but self-care and team connect plan, how to do it. The philosophy of care, a sample clearance letter request. Business forecasting, how do you do it? Team engagement, rehiring considerations, HR tactics, then scheduling, patient priority management, communicating with patients, patient flow plan, from facility protocols, patient engagement, arrival protocols. This takes stuff from CDC, ADA, and everything else, and it puts it together in a format that I think is amazing. We'll talk about in a minute, self-care and team, increase stamina, improve nutrition and sleep. That has resources here. ADA return to work guidelines. You can grab them here. OSHA, CDC. We also are starting a program next Wednesday. It's called Activate a Productive Practice in 30 Days. You could enroll there. I'm going to talk a little bit about that in a while. But I just wanted you to be able to see these things and get the realization that things are, this is a great document and things are changing. So that's the deal. Step 2, scheduling based on productivity. This is something that we talk about at PDA all the time. It's an intentional activity. And what I'm going to talk about is going to you're going to shake your head to some of it because it's 180 degrees different than what you've ever been taught. No longer can you schedule patients like a dart and a dartboard. Just, Mary says, I need to come in for an appointment to get that crown done. And your team up front just goes, bink, Okay, how about Wednesday? That's not the way to schedule. This is effective for fee-for-service as well as PPO practices, scheduling for production. Longer procedures are going to be super important. So let's look at scheduling for productivity, not time. Productivity comes from only two sources, what we call our new patients and our hygiene annuity. Hygiene annuity at Granbury Dental Center, we have 640,000, it could have changed, but 640,000 per month come through hygiene. These are patients that have been fully diagnosed and treatment planned, but didn't do the work yet. You know, they couldn't do it for whatever reason, but they're still in what we call our hygiene annuity. New patients seen with a doctor first tend to schedule more treatment. There's no questions. And these exams are about relationship. It's not about productivity, the exam itself. It's about the goal. How do we figure it? Your mission is to run a successful business and take care of your patients, but your overall goal, I have two things that I look at as my goal. Number one is to take great care of my patients. Number two is to reach whatever goal I've set. So if I set a goal for 500 an hour, if I set a goal for 700 an hour, I'm 100% committed to doing 700 an hour. So that's different. I mean, there is no, and it doesn't mean I'm running around like a chicken with my head cut off. I'll show you. Your daily schedule must be engineered. It has to be an intentional activity. Patients are going to choose whatever times you offer. So give them the times that are best for you and your business. And again, scheduling for productivity, not time. Schedule has goals on each day. Staff uses it to ensure reaching their goals. If you're not diagnosed in dentistry, it's hard to reach goals. And that's where we talk about comprehensive treatment planning. This is a typical schedule. I'll let you know most of you know, I started Productive Dentist Academy 16 years ago, and Vicki McManus is my partner. But we've been teaching this. I've been doing this now for probably 25 years in the office. For 15 years, I've only worked 2 days a week, Mondays and Tuesdays, and was able to produce at, $2,500 to $3,000 an hour and do over $2 million in production each year. Now, how was I able to do that? Well, because I schedule based on productivity. And that's really what we look at. So I'm just showing you just an average schedule on Monday, and this goes back to 2009, but, and it hadn't changed. This is Gay's chair. This is Summer's chair, and this is Shannon's chair. This is a non-productive chair, meaning 1 hour crown seats or whatever it is, or maybe not crown seats. It might be impressions for a whatever, but 1.5 in Gay's chair on Monday, 2 hour block for Summer on her schedule. But when we switch, it's just the opposite. We see new patients, 1 here in the morning and 2 right after lunch. And we see emergencies right before lunch. That's just a standard template that we work on. Many of you understand major blocks. Major block, if my goal is 500 an hour, then I'm going to put something in here. I want to put 750 in because that's an hour and a half. Here, I want to have 1,000 in. Here, I want to have 750. You got to remember that the average dentist is doing 425 an hour, which is about $3,400 a day. Now, I'll be honest with you, $3,400 a day is not very much dentistry. I mean, most of us on this webinar, I would do that between 8 and 10. And then I would go to the golf course. I would have a tea time at noon every day with my buddies, if that was my goal. You could do incisal composites around stuff that's not going to take you a long time. New patient emergencies, there's your new patient slot, and emergencies before lunch. Now, this is where that throws everybody off. It throws everyone off. And I've been doing this now, teaching at PDA for 16 years. My question to you is, if your goal is 500 an hour, you did 2 crowns at 900, 2 builds up at 150 for a total fee of 2,100, how long is it going to take you to do the procedure? I have doctors say, well, it's going to take me probably an hour. This is doctor's time only. Oh, it'll take me an hour and a half, even 2 hours. And then I ask, well, how long will you schedule? They go an hour, hour and a half, or 2 hours. That is, it's like, nope, not the right answer. Because what we're going to do is we're going to schedule for 4 hours and 10 minutes. You're saying, Bruce, that's the stupidest thing I've ever heard in my life. Well, it's the reason I don't run behind during the day. Whatever my goal is. Now, if your goal was 1,000 an hour, you're going to book how much? You're going to book right at 2 hours. Okay. Because that's different. It depends on what you have set for your goal. So if it's 500 an hour, when are you going to do other procedures? You know, when are you going to do other things? Well, another place that you could do things is you could do molar endo. Because what am I going to look at right here? I'm going to come in at 8 o'clock in the morning and I'm going to sit down, especially now that we have all this PPE stuff. You're going to need to anesthetize a patient and not get up and leave the room. You've got to use buffering for your anesthetic. On Pharma has, they're doing some neat stuff now. So that's On Pharma, and we'll add that into the webinar stuff. I talked to Mick Falcow, the founder of that company, yesterday, but he's right on. I mean, you're going to anesthetize a patient in 90 seconds, you're ready to start prepping teeth. And what you want to do is you want to prep, boom, you're finished. Now your team takes over and you now can go over and do molar endo in that room or whatever else, see a new patient, do crown seats. I have five hygienists that I would check. So it's not about time, it's about production, and it's based on your goal. So hopefully you guys are following that. You know, if you fill your blocks, you know, if you just filled your blocks, everything that's off the side is add-on production. So, I mean, you're looking at following a 750 book here, 1,000 here, but you end up in that 4 hours doing 762 an hour. Why? Because you scheduled it properly. And this is the time. The first time in history we have 200 to 1,000 patients waiting to be scheduled who previously had an appointment. It's a clean slate. You know, if you were averaging 450 an hour, this is your chance to double production. How do you do that? It's an intentional activity. You're gonna make a list of the patients from the highest production that got off the books all the way to the lowest, and then from the highest need all the way to the lowest. You know, you're not going to have an emergency buccal pit. You don't want that in your schedule now. You've got to make up for lost time, 6 weeks of no revenue. So this is the time to do that, or 8 weeks, who knows? And leave room for other pent-up demand patients. You've got to, you know, so you're scheduling based on that. I'll show you what I mean. Let's just say you had a patient that needed a 3-unit bridge. You're going to schedule it and your goal is 900 an hour. You're going to schedule that for 4 hours. You know, that's what that is. Now, why would you schedule for 4 hours on something that's going to take you 40 minutes to prep and take an impression and send to a lab or make on a CERAC? Because now you have other places you can put people. Patient B is $1,000 in production. I can justify doing this because patient C production, 1,800 and 1,800 here. What am I doing everywhere else? Emergency here, emergencies here, emergency here. You know, I can do non-productive procedures over here. I want to, once I'm on that goal of 900 an hour, I want all the patients that I can possibly see in around it. And it's not, I'm not going to be running behind. I'm literally going to be staying on schedule. Because here I've got an hour and a half in here. It'll be a little tight when we first start out, but I don't have to prep this one right away. I might prep this one, then come in here 20 minutes after the fact, 30 minutes, and then start, get it done. Come over here and, you know, because you're going to have to be changing gear. You're going to have to be, you know, it's not the old normal. It's a new normal. So let's look at step 3. Saying yes to same-day treatment. First of all, you've got to have room for it. So designate in your morning meetings where you want these emergency patients. And then with a thought process that says, I am going to do same-day dentistry on them. If they come in, they've got endo, I'm going to do endo. I'm going to do endo, post, build up, crown. Boom, I'm doing it all. And that's how you're going to make up for lost time, truthfully, because you got to make up for it. If you don't, well, you're going to have a bad year. The guys that work with us at Productive Dentist Academy, I'm telling you right now, we're anticipating that at the end of the year, they had set goals for growth of maybe 5, 6, 8%. I'm not going to guarantee that they're going to have 5 or 8%, but I want them to reach their previous year's, you know, production goals. And I think we can do it. Have tray setups ready. Have, you know, most of you do this, but have everything ready. And have maybe designate somebody, if you could, a treatment coordinator to handle all the treatment that comes out of hygiene or emergencies, and just find a room. You know, now if you only have 2 rooms that you're doing dentistry in, it's going to be hard. But if you've got, you know, an office that has, you know, maybe hygiene hadn't come back, do whatever it takes to be successful. That's what I'm saying. whatever it takes. Step 4, new patients are scheduled with the doctor only. Okay. Comprehensive exams on every new patient. You just do a comprehensive exam. Obviously not if it's an emergency patient, but you're going to convert them after you handle their emergency into a comprehensive exam. We've seen an increase of 31% in productivity when the doctor sees the patient first. It's critical. And you're going to block a hygiene time after new patient slots. So if I have a new patient, because patients call up and they go, hey, I want to get my teeth cleaned. And you go, well, your new patient to practice, Dr. Baird wants to meet you. And then we'll do our very best to get your teeth cleaned right after that. So we block, we don't push that on one hygienist, but each hygienist puts blocks after the doctor's new patient exam. And that's critical. Let's look at seeing if we have any questions, Stephen. This is a good time to do this. If it is a good time, we'll see.
Yeah, I got a shy bunch today. I haven't seen any questions come in the tab or for the chat yet.
Good. Well, I'll come on. We'll just keep on pushing.
We'll push on through. You bet. So get those questions in, folks. We'll get them at the end today.
I'm going to go down here and we're going to end the poll, and I'm going to share the results. So this is really good news. Do you have plenty of PPE to last for 1 month? Those numbers 6 weeks ago were like just the opposite of this. Probably 20% said yes and 70% said no. Do you have antibody test kits? Those are going to become more and more available. We usually have nobody has them, but we're starting to see we have 6% of the respondents have it. And have you invested in new filtration UV system for your practice? And I love seeing this. 69% say yes. Do I think it's absolutely necessary? It's really good for marketing, and it's really good to show patients what new things you're doing. So I'm going to pop another poll question.
All right.
As soon as I stop sharing this.
And I put up a poll in our compassionate community as well, just seeing who's open and who's not. And it looked about like that PPE. I'd say about 70% of the practices are open, and then we still had about 30% who aren't.
Yep, that's what we're seeing. I'm going to launch this poll, and it just is talking about fee-for-service, PPO environment. So I'd love for you guys to respond to that if you could. All right, let's keep trucking. See you in a minute. Step 5, new patient options. Even patients with cash will have an extremely difficult time paying because they're prioritizing their spending. Trust me, they would rather make some monthly payments than they would give up cash. That's what we saw in 08, and that's what we're seeing now. They would rather finance and hold on. Cash is king. Less third-party payment options and amounts, that's going to happen. There's just going to be less of it. CFI, Comprehensive Finance Inc., it's FinTech for healthcare, and we're going to talk a little bit about, and I'm going to get these sent out for you guys. These are some Excel spreadsheets that you can load in the treatment. This is if you're using Care Credit, or you could change the name to, Green Sky, or you could do whatever, and this will figure in their payments automatically. Pack checks, some people still do that, half and half. These are some old ways of doing it. CDF, which is compassionate finance. And with some directions, and a patient contract signs it, and that's just going over their financial arrangements. Doing financial arrangements is not that difficult. And if you decide you're not doing third-party financing, we have one that also has no third-party financing in there. It's all compassionate finance. So let's look at that financial discussion. You need to understand the difference between cost and affordability. This is absolute critical. Learn how to make the dentistry you're offering affordable. For every 10 crowns diagnosed, according to Gordon Christensen, and Howard Fran last week said 95 out of 100 are done one at a time. One at a time. Why is that? We diagnose 9 of 10 crowns. They're done one at a time. Dentist diagnoses 5 crowns, and it could be $5,000 worth of work. It doesn't matter if it's crowns, but will my insurance cover it? You guys ever hear this? They'll cover a portion of the treatment. Your portion will be $3,500. Can we just do one? You ever hear that? Can we just do one? And your team, because they don't like conflict, they say, sure, I'll get you set up. Is that really the best way of doing things? Even worse than this is when the dentist starts to believe it, because they hear it 95% of the time, can we just do one? And the dentist hears it and they start doing one crown at a time. They go in to do an exam. Wow, this tooth broke. Let's do a crown. Oh, looks like this one. Let's do a crown. Well, that's not what patients want. If they need 5 crowns, they want to get it done as few visits as possible. And so do you. You know, why does it happen? Because they can't afford it. Do you know that the average person has a $4,400 in their savings account in America, and almost half have no savings? None. So how do I help patients move forward with all the crowns they need? Well, or all the work they need. The dentist diagnosis $5,000. It might be quad scales. It could be 3 fillings, 2 extractions, a graft, and a crown and an online. I mean, it doesn't matter, but they always ask the same thing. Is my insurance going to cover this? Well, they'll cover a portion. And by the way, you have 40 million people who have lost their jobs, so they don't have insurance. So, you know, that's another issue. Your portion will be $3,500. Can we just do one? Same scenario, but we do it this way. Bob, you could, but why don't we just use your insurance as a down payment, and we can work out convenient monthly payments as low as $85 a month. And Dr. Baird can give you a pill and you can sleep, and we can do all the work at one time. Now, I've been doing this for 10 years. And what I can tell you is that I've never had a patient turn that down. Instead, what dentists do is they go, well, I tell you what, that sounds good. Let's do one. And then let's next year use your insurance to the max, and we'll do another. And then the next year we'll do another. And what happens is in 3 years, now they've snapped off number 12 that you were going to do an onlay on. And now you're doing an extraction, graft, implant, crown for 5 times the cost. Truthfully, we're not helping people by doing it that way. It's ridiculous. Plus, insurance companies are screwing you the whole way. You know, they're only paying $750 when they have $1,500 in benefits. So which would you rather have? Let's look at these 2 scenarios. Practice on the left, practice on the right. You have $1,500 in insurance, you have patients that come in, or $1,500 down payment. Doesn't matter if it's insurance or a down payment. They both need $5,000 worth of work. You tell them their portion is $3,500 on the practice on the left. You tell them their portion after insurance is $3,500, but you have convenient monthly payments for the balance as low as $85. They get all their work done. You get to do it in a single visit, which is going to be paramount in this new normal. You're going to have longer visits. You can sit there. You don't have to change your mask and do all that stuff. You want to do more dentistry in single visits. They decide to do only what insurance will cover because they don't have the money. So you tell them, well, we can do $3,000 worth of work to maximize your insurance, and your portion will be $1,500 and insurance will pay $1,500. Then what happens? They don't have $1,500. So you do less dentistry, say $1,500, their portion $750, and insurance pays $750. And let's assume you have 50 of these patients that come in your first month back. And I promise you, you'll be seeing 4, 5, 6 of these a day. So 50, and I'm just going to say these is the only patients you saw, and let's look at what the production is. You're going to produce $1,500 per patient, or $75,000. On the practice on the right, you're going to produce $5,000 per patient, or $250,000. Which one do you want to be? You want to be the practice on the right or one on the left? Well, on the one on the right, you're thinking, well, what if they don't pay me? Okay, that's what you're thinking, I know, but let's go further. The patients over here in the practice on the left had to pay $37,500 in very difficult financial times. Practice on the right, that patients pay $0 out of pocket in very difficult financial times. Insurance pays the $75,000, and you end up with $175,000 worth of short duration, high yield paper. It's called debt paper. It's paying you anywhere from 9% interest up to 17.9% interest, depending upon where you're at. And you're going to see that money coming in with interest over the next 12 to 60 months. Be careful, the herd mentality, be careful when you follow the masses, because sometimes the M is silent. We've got to do things differently. We have to. I'm going to share with you, we're actually at Productive Dentist Academy. We're starting what's called Recovery Tactics from the Productive Dentist. It's starting next Wednesday night, May 27th. You can go to productivedentist.com/activate if you had an interest. It is 30 days. It's $299. So it's a, we charge $4,000 to come to the seminar, productive dentist seminar, and we've helped thousands of dentists over the years. We want to continue to do this. It's a different normal. We're not going to be doing live seminars. So this is a way of us doing it where you can bite off a little bit at a time if you choose to. Week 1, the productive mindset. It's productivity. It's not what you think, it's what you think. Redefining patient care, PPE and PPP and PPO and everything kind of stuff. Week 2, we're going to have resilient leadership. Week 3, team engagement. Week 4, authentic marketing. And you'll get a copy of this. And this is, again, it's beginning May 27th. There's 8 one-hour mastermind sessions with me, expert advisors, Victoria Peterson, my partner, Renee Lewis, Reagan Robertson. You'll have a digital workbook. We're going to have a private Facebook group just for the people for the seminar. And anyway, I'd love to see you guys come on with that. Compassionate finance is what we're talking about. We're in it for good. The most innovative payment solution that makes dental and healthcare affordable for everyone. Working with compassionate finance, what's your risk? Well, you're not putting up money, you're putting up time. When a third-party financing does $10,000 worth of work, they give you $9,000 in cash. You better believe they got to know that that patient's going to pay that cash back. And so that's why they approve certain people and they don't approve everyone else. Your hard costs are covered. We always recommend getting a down payment, at least, well, not at least, 20% seems to be a good number. And the reason that is it covers your hard costs. And when I say hard costs, that's your lab fee and your supply cost. Now, people will say, well, yeah, but I have other overhead. I've got more overhead than that. Yeah, but you're not doing the dentistry on these people. These are people that we're going to go down the street or only do 1 crown. When you're using compassionate finance, you're doing more dentistry. And so if you're covering your hard costs, you're getting to do more dentistry and you're relying on your time value, meaning, hey, this is the value of my time. If I've got an opening, I'd love to sit down and do $10,000 worth of dentistry. If I get $2,000 down, I'm off and running. I'm good. And I'll show you. Interest offsets risk. That's where people are asking the question, well, what if they don't pay me? What if they don't pay me? How are you guys like Care Credit? We're not. You're going to be on the right side of interest for a change. You actually get interest, and that offsets risk. Let's look at that. This is a great chart, and everyone is fighting for the A's and half of the B's. That's good credit. A lot of the finance companies will say, yeah, we'll go down to 600. I'll be 660. Well, okay. They won't be now. I'm saying 680. So part of the B's and A's. So all dentists are fighting for these people. Why? Because third-party financing will accept them. And number 2, they have no other options for the others. Well, I'm telling you, the C's, D's, and E's, I don't care if somebody comes in that's driving a crystal blue Mercedes and they're an A, or somebody who comes in with a F-85 Oldsmobile with primer paint on it. I could care less. Why? Because I know the data. I know that these patients are considered subprime. Nobody loans them money. When they need money, they go to a pawn shop. When they need money, they go, that's what they do. But let's look at our subprime data. We have over 70,000 patients that have paid full term, almost 300 million in notes. So we've got more subprime data in the last 10 years than most any company in the country. So we know that an E, which is below 500, we know that an E defaults at 17.5%. And you would say, well, I never want to do 17.5. I'd never do that. Why would I ever do that? Well, let me explain. 82.5% pay the full term of their loan with 17.9% interest. Now get your financial calculator and run those numbers. What you're going to find is you're making more than your regular fee by helping E's and D's and C's. Interest, what happens if they don't pay me? The interest off of the 82.5 people that pay offset the 17.5 that don't pay. We know it's true, and we've proven it over the last 10 years. I don't want to finance patients for more than 12 months, commonly heard. Let's look at a loan calculator. $2,400, 1 year. Look at this pie right here. That pie is interest. Watch what happens when it goes to 2 years, 3 years, 4 years, 5 years. Your piece of the interest gets bigger and bigger and bigger. I don't care if a patient chooses, because they're going to choose the payments. I'll show you that in a minute. They'll choose what payments they want. And whatever they want is fine. I don't care if it's 60 months. On some big cases, we go 72 months. So how do I totally fund my retirement plan? We have docs that have totally funded their retirement plan every year just off the money that's coming in. Paid off all their student loans without affecting their take-home pay at all. So how do I recession-proof my practice? This is a strategy that by helping one patient a week, you're going to be able to follow this. Patients have, just say they have $1,500 down or insurance of $1,500. They need $7,500 worth of work. I multiply 1,500 times 5, that's 7,500. So that means 20% down. So I can, if anybody has $1,500, I multiply it by 5 and I can do $7,500 worth of work using compassionate finance. I accept that as a down payment. I finance the remaining $6,000 for 60 months. I'm going to assume it's for 60 months with an average interest rate, which we know being about 15.9 if you look. Most of the notes we do are subprime. Payments of $145 a month. I mean, imagine that. Now you're getting to do $7,500 worth of work and they're paying $145 a month. One appointment with sedation, you're going to need to start doing these kind of cases. I'm just telling you. You know, you get to help more patients. And so I'm going to show you this, just what I just showed you a minute ago, this, by doing $6,000 in financing a week, about $25,000 a month. This is what you could do in your practice. Totally recession-proof your business. I'm going to assume a 20% default, which I told you the worst of the worst is 17.5. Our overall default's around 11.4, but I wanted to put it as a worst case scenario and all the fees that compassionate finance charges. Let's look at it. You help that one patient a week. At the end of 12 months, you have monthly payments of about $5,600 coming in. You have a portfolio, which is super important because that portfolio is not an account receivable. That's an asset. That is an asset. So if you started July 1st, by July of next year, you're going to have almost $250,000 in paper that's owed to you. At the end of 60 months, this is crazy. You know, you'll have monthly payments, 28 grand a month. Now, remember, I said it was 60 months. Every single one of these was 60 months. Well, some of them are going to be 30 months. So the payments will be higher. So looking at this, if you were to help one patient a week, your monthly payments could be up at 40 grand, 45. We have doctors right now, and I get letters all the time from them that have 30,000 a month coming in, 10,000 a month coming in, 40,000 a month coming in during the pandemic on work that they did 2 years ago. And they are loving the fact that they have a secondary business, another business that has cash flow even when they're not working. Portfolio, almost $1.2 million in 5 years in July. That money right there is unbelievable value. You could use it to refinance a house just as collateral. Plus you already have all those monthly payments coming in. So let's look at the face of compassionate finance. I'm going to share with you about compassionate. She wouldn't have been able to do the work. And this is the day after we did an immediate extractions. And she got makeup on, no makeup. She's got makeup on. She loves her smile. That's what it does for people, you know, and we're able to help more folks because we make care affordable and it doesn't hurt you. I was on a previous podcast this morning and I can tell you over the years, we've got thousands of dentists that have been using us and we've had nobody with cash flow issues, you know, nobody. They said, well, if I only get 20% down, I'm going to have cash flow issues. No, you're not. We actually have some offices that actually do more in production and more in down payments than they used to produce. So what can you expect? Help more patients by making care budget friendly for everyone, perform more comprehensive dentistry in single appointments, which is what you're going to have to do in the new normal. I just promise you, I was in the office Monday. I think dentistry is going to recover wonderfully, but I'm telling you, you're going to be doing less appointments. Generate more revenue. That's monthly payments with interest. We're going to tell you to open up a separate bank account. You know, when patient pays a down payment, let's say on 10,000, they pay 2,000. That goes in to your software as a down payment. You write off the 8,000, just like you're writing it off as a PPO discount or a professional discount. It goes to compassionate finance, and compassionate finance takes over from there. And I'll show you what happens. Industry-leading cloud technology for evaluating risk and loan performance, best-in-class training and customer support. And our experts manage every aspect of your loan. Here's a simple, if we do it on an iPad, takes about 5 minutes. A patient can complete an online app. This is what I want you to see. You're going to see something that says application approved. Okay, but look here. Interest rate is 17.9. You could charge up to that in 38 states, or some states you can't charge that much. But if you see 17.9, you know this is an e-patient, sub 500 credit. Why on earth would we do this? They have a bad credit rating, no doubt. But we look into their bank and checking history. They pay their bills on time. They don't write NSF funds. They don't do that kind of stuff. But what would happen if we got where this was bad also? Let's say you had a bad credit rating and bad here. What it will say is call for manual approval. Now, we have some offices, they accept everybody. Now, I'm not sure I recommend that, but that's their policy. If you fog a mirror, you're approved. What I say is, it depends. You know, if I had a patient coming in, needed 4 crowns, or say 4 implants, and that's $8,000, and they go, Doc, I'd like to do it, but I only have $5,000. What am I going to say? Oh, we have financing for the rest, because I know it's going to take me 1 hour and it's $5,000 cash. I mean, that's business 101. You don't have to be a rocket scientist to figure that one out. Yes, you're going to do it. What if they don't pay me that $3,000? I don't give a crap. I mean, I don't care. You know, I just made $5,000 in 1 hour. Now, they're probably going to pay some, and they'll probably fall off the bandwagon. They probably won't pay me. I don't care. Anything that I get on top of that 5 is gravy. They get to pick a monthly payment. So let's just say a patient says, well, I think I could do $286. I don't ever want a patient to say, I think I can. What we'll do is, and our team is trained to say, well, why don't you do this, Mary? Why don't you just do $144 a month payments and do, be 42 months and make it easy for you. Patients go, oh yeah, okay, well, I'll do that. And you can prepay anytime. And, last week we had 24 patients pay off their balances in 1 day. There's a lot of people out there, they're still working. It's a retail installment agreement. This is different. It's a signed contract. This is not you telling Bob, why don't you pay me for the next 4 months? Just pay me $1,000 a month for the next 4 months, because then in 2 months, Bob, you don't get the check from Bob. And then your team is trying to call them and they're not answering the phone because why? Because they know it's you calling. And so, this is a retail installment contract with a third party, Compassionate Finance, which is really your finance company. Unbelievable dashboards. You can look into, every bit of information that you need. We bill, collect from patients via ACH every month. We direct deposit it on Fridays. We provide all the customer service. And if we need to do collections, we'll institute collections. 20 million in interest paid out. And this is the pricing for Compassionate Finance. Account setup fee of $1,500, a software licensing fee of $199 a month, and a portfolio management fee of $4 per transaction, which is monthly, and then 0.5% of the remaining principal. Meaning if you have $100,000 worth of notes, it's going to cost you about $500 a month for us to do all the collections. Until July 1st, we waived the setup fee. There is no setup fee. We've waived the software licensing fee. So, it's a perfect opportunity for you to get involved with Compassionate Finance, in my opinion, and that's totally waived. We have another product called Abella that does accounts receivable. You can ask questions about that, and we can talk about it. We've waived all the fees on that until July 1st, so you can actually start collecting some of your accounts receivable without even spending any money. So let's take a look. Recovery tactics. Remember, you can go to productivedentist.com to activate. And let's stop sharing and see if we have any questions.
We have questions. One question I would answer, if you send me an email on July 1st asking if you can get set up with Compassionate Finance for no setup fee, the answer is going to be no. So everyone...
Yeah, this says, I'm going to end the poll and I'm going to show everybody kind of what we're looking at. 13% of the people on the call are 100% fee for service, 9% are 100% PPO. And what we've seen at every one of these is there's some combination of both. So you're dealing with those things, and I'll share those results with you. So let's go through the questions and see what we got.
All right, perfect. And I did put that link to the offer over there in the chat. If you want to click through there, if you're still not convinced about compassion finance, you can click information and get a demo sent your way and get one for Abella too. I know we didn't go over that today, but you certainly want to take a look at that product.
We'll attach today the Abella program that we did. Okay.
Oh yeah, 100%. All right. So how do you work in hygiene checks in your productive schedule?
Well, for instance, if I booked 2 crowns or 3 crowns and I did it based on time, how long it would take me, it's really hard to check hygiene patients. Now, if I did it on time, if I did it on production, my goal is to pull my blocks down and I will have accomplished my goal for 4 hours that day. That gives me time to go check hygiene during that. Now, it's going to be much harder to go check hygiene. I would probably institute something where we're only doing an exam once a year, unless there's some emergency. So you're going to kind of cut back a little bit on that. That's what we're doing. We've been doing exam once a year with 5 hygienists. We've been doing that now for, I don't know, 15 years.
All right, excellent. This is kind of almost like a follow-up to that one. If the hygiene block after the doctor's block, few patients show up 2 at a time on the same day.
Do patients show up? Is that what the question is?
I think it meant to say few patients show up 2 at a time on the same day.
Yeah, what we do is we're going to do we always have that available. Now, here's the thing. If we have a patient calls up and in the notes for the new patient, it says, my teeth are terrible. I just want to get them taken out. I just want to do that. Well, then we go ahead and fill that spot. We're not waiting for a hygiene. If they call and say, I really want to get my teeth clean, then we make sure that we have that spot there. If 2 people showed up at the same time, I'm not sure what the question, but if they did, we'll figure out a way to help. We're just going to say yes. Can we help you today? Yes.
Perfect.
Absolutely.
Dr. Nichols just had a question over in the chat here. How long does it take to get set up and then start using after that?
Setup is, it's pretty much instantaneous. We can set you up in 30 minutes and you can start doing loans. We've set people up and they started doing loans the same day.
Mm-hmm.
And we've got docs right now that have signed up in the last 8 weeks, and we've signed up more people in the last 8 weeks than we did in the last year. And the reason I say that is now's the time to use these type of products. I've always thought it was time to use them, but now people are starting to realize how important it is for longer visits. Don't worry about this paper. You're going to love it. It's going to be a secondary stream of revenue for you. So it's going to allow you to do bigger stuff. And we're already back to where we were. We're already back up to where we used to be before the pandemic, and only 70% of practices are up and running. So a lot of people are going to need this.
All right, got one more from the chat here. Will a photographic check or a radiographic check in lieu of a physical check, if the patient be acceptable for billing purposes, check equal exam?
I don't know the answer to that. I know that every state has different regulations, so you might check with your state. I know they feel like they have control over everybody now, so they're making all kinds of rules. There have been times where I couldn't leave a surgery, and I've pulled up the x-rays. I'm not sure if we charge the patient for a doctor's exam, but I looked at the x-ray. So I've done that when I was in surgery, and I said, tell them I'm going to, they took pictures, and just tell them I'll give them a call afterwards. So that's what I did.
All right, perfect. This is going to be an interesting one. Dr. Feliciano says, I received a PPP loan, but not an EIDL advanced. I followed up with the Small Business Association, and they sent me an email and said I was eligible for a $150K loan. Does this mean I'm not getting the advanced EIDL anymore?
You were eligible for the EIDL loan at $150,000. I would think that you would have gotten the $10,000 grant up front on that. I haven't heard of anybody just having the bank call them. Now that they have time to actually get to some of the applicants, because there are people that filled out the EIDL loans 8 weeks ago that are just getting contacted in the last couple of weeks. So what I would do, cash is king right now. If I could get a loan at 3.75% for a 30-year note, I'd take the money. and then I'd let the market bottom out and I'd put it all in the market. No, I don't do that. I'm just telling you, I already told you my results. So don't do it.
All right. The next one is, how do we get the financial template?
We're going to send it to you in today's stuff. I'll send it to you.
Yeah, there's all sorts of good buttons you can click in there. So we do put some downloadable documents into the follow-up email. So there's going to be lots of good links.
These are the type of things that we give you and design at Productive Dentist Academy to help dentists go. I mean, the thought process, what if I went up $50 an hour? Well, if you go up $50 an hour, which we routinely can help you just virtually go up $50 an hour, but that's 80,000, over a period of 3 months. So, it's just a different way of thinking. Productivity is a different way of thinking. It's not about running around like a chicken with your head cut off. PDA practices, they don't run behind, unless they're not on goal for that day. Then they'll work through lunch. They'll work at the end of the day until they finally reach goal, or they just say, we did everything we could. So that's what we do.
All right, perfect. Yeah, and I'm going to put a link for that course that you're starting. If you like that financial template, you should just see all the resources that they're going to provide for you. You're going to love them. All right. Do you have any recommendations on UVC?
We'll put what we have. We got a wand, and we've got links to all of those. So we'll make sure we include that also. We have one of my docs that's a PDA doc. Today's his birthday, Dave Deal. Happy birthday, Dave. He's up, he's up in Fort Wayne, Indiana. And he and another guy in his town who's like a engineer guy, they designed their own UVC lights that they carry in the room, and they go around the room, and they're obviously not available to us, but anyway, you can be very creative in sterilization techniques.
Yeah, I heard something. There's a company in Dallas too that just won a bunch of bids with hospitals that has like a revolutionary temperature taking thing. I'll see if I can find a link for that. I thought it was pretty interesting, called Willow or something like that. It's pretty cool.
I actually saw that. That's crazy.
All right. Explain short-term paper and 9 to 17%.
Short-term paper is considered, it's not mortgage paper. People are willing to buy mortgage paper, but they love short-term, high-interest paper. In other words, the value of that paper, of that kind of paper, is actually a higher value than a mortgage. Because that's a 30-year note. This is 17% for 60 months. It could be 10%, could be 12. Some states you can't charge up to 18%. That's okay. We have some guys, we have about, over 50 offices that charge 0% interest because of religious reasons. They raised their fees 3 to 5% and then went to a 0% option. There's lots of things you can do. There's also an entire scenario, and we can include that on how do you pay your associates. There's a really innovative ways that you can and create revenue. Associates working, keeping their schedule full, plus creating paper for you as the owner. And I'm telling you, did I talk about my buddy that did 800,000 right before he retired? I did. My buddy did over $840,000 right before we retired. So he had $840,000 in short duration paper. It wasn't a record, but it was close in 1 year. And because he did everybody that came in, he wanted to max out what they were able to do. He then retired, took the paper with him, moved to West Palm Beach, lived on it for 4 years. And now he's going to go back to work and do it all over again. So you can do whatever you want to with it. It's your ability. If all you're doing is 1 crown at a time, and that's what you're doing, that's what you're going to get. If you're doing 5 crowns at a time and giving people affordable monthly payments, you're going to create this secondary business that within 5 years to 7 years, you'll be making more money there than you used to make in your practice. And you can use that money to do whatever you want to with.
Yeah, well, we're kind of wrapping up this webinar series, the Wake Me Up When This Is Over. We're going to do some new ones in June, and we're going to have a doc just like you're talking about on one of our first episodes on June 2nd. So y'all show up, especially if you sign up for Compassionate Finance, you'll see what's possible when we talk to some doctors who are using it in practice right now, even since COVID.
Yep. and we're doing, we're doing a lot of, some of those will be in the evening so that you guys will be able to come on in the evening, when you're working and hopefully producing at 100% of previous months. So that would be fun.
Yeah, we're kicking around the name like Moonlighting with Dr. Bruce Baird, all sorts of fun names, right? Like Bruce's Poolside Cabana instead of the Fireside Chats.
Yeah, Fireside Chat yesterday. I'm in Texas and it was 97 degrees. It was not a Fireside Chat. As soon as I finished that thing, I did a Facebook Live, which I'm doing today at 11:15. So in about 20 minutes. And I'm going to have some guests on, but every day this week at 11:15 in the morning, I'm going to be doing, after our deal, I'm going to be doing a Facebook Live. So I don't know what that has to do with the price of rice in China, but hey, that's it.
Hey, can I drop a link to that Productive Dentist Facebook group into this chat? Is that okay? Or
Sure.
All right, perfect. See if you can go join Dr. Baird over there. Okay, we got a few more questions and we'll wrap it up for today. Another PPP question from Dr. Feliciano. Can vacation pay due to employees be paid with the PPP loan?
I believe so, but here's the deal. They're coming out with new guidance, and I think it's going to be to our advantage. They realize now, I was listening to the guys supposedly who know yesterday, and they're saying we may extend the 8 weeks to use 75% of the PPP for employees. They may extend that to 16 weeks, even to 24 weeks. Even if they extended it to 12, it would probably work perfectly. So, because we want those loans to be forgiven. We did it with Productive Dentist Academy. We have 47 employees, I think it is, with PDA. We have 30 some odd with compassionate finance or comprehensive finance. So, and we use the PPP loan, and we've set a separate account for the PPP, and everything that we're doing is fully documented because our goal is to have these completely forgiven.
All right, perfect. All right, here's one from Dr. Salisbury. All right, and it's not related to golf so far. So, all right, here we go, Herb. In my new practice, I am considering 2 hygienists and do meet and greet, then hygiene. Have 1 op for some needed procedures and then same day stuff. No change in fees yet, but introducing OS info. What do you think?
I think that's something that can make some sense. I think you have 3 ops, I think, is in the new office. Is that correct? I probably would have 2 for me and 1 for hygiene, and especially doing the oral systemic that I know you're doing. So I might consider doing it that way, but you and I'll visit about it and we'll get that stuff out. Yeah, he's got 3 ops. So I would always keep, unless hygiene is producing at at 500 an hour, I'd rather have those 2 chairs being for my operative production treatment, even in the COVID environment.
All right. Hey, speaking of the COVID environment, do you use teledentistry?
In Texas, we're not able to. They said we couldn't. I know that across the country, a lot of our PDA docs now are using teledentistry. They're doing consults using teledentistry. They're actually looking at patients. When they call with emergency, they'll call them back and get them online and look at the problem, So yes, we do recommend it. I think there's going to be some really neat new opportunities out there. I just know, and new systems to be able to do dentistry. Obviously we have to work on teeth, but I really do think it's going to be something that you're going to find the pre-consults that you do for big cases. I think that we'll be able to do that online. Instead of having a community program in our office, we might be able to have a community program through Zoom. And that's what I would be thinking right now. How can I best use the technology to be able to create something that we haven't been doing in the past? And that's what innovative people do to become successful. So it's awesome.
All right. I have an interesting question here. If you have a separate CF account and thus write off the patient's accounts on the dental software, It gives the impression of lower collections. How do you explain this to a potential practice buyer?
It really won't give you any different collections, because what you're doing is you're adjusting it off. So if you produce, it's the same thing as if you're a PPO practice and you're writing off 40%, which, by the way, is about the average PPO write-off. That's the highest overhead item. It's the same thing. If you write off 40%, that means you're not going to collect it. You just sent that over to your other business. And now what I do in that separate business and in that separate account for my team goals and bonuses, I always count CF as compassionate finance as part of our goals. Our daily goals, we do something called grab bag, which we're going to be talking about over the next month with our new program that we're teaching. And we count production based on total production for the day. Then it's taken off. But I want to do more paper, so it drives it over to my new company that I have. I also, if I get 20 grand a month coming in, I credit that 20 grand to the team for our overall, what we call profitability incentive point, which we will talk about that someday. But anyway, we transferred over. So they know they're getting credit for it. I'm just leaving it over here. And this is where we've had docs bought an airplane, paid off their house, opened up additional dental offices because they had so much paper that the bank says, heck yeah, we'll take that as collateral. And so there's lots of options for that. I hope that answered that.
Yeah, oh yeah, and then some. All right, perfect. So the last one from Dr. Collin today: how do we enter a payment into the Dendrix ledger if the patient uses compassionate finance?
You're actually not going to be putting the individual payments. You're only going to put the 20% down. The individual payments are going to be going into your finance company with interest. So I credit that towards it, but I do that theoretically for my team. I could care less about, and my CPA understands that this is a new business and I got revenue coming in every month. And when was the last time you had a separate account? And let's just say you're getting $5,000 a month. Well, that's not that much dentistry. That's helping people. But, all of a sudden at the end of a year, you got 60 grand in there. But imagine having 20,000 a month coming into that account. You got $250,000 over there. I mean, most dentists work their whole career and hope they could sell their practice for $500,000. Now you're doing paper and creating a business that is absolutely knocking the socks off, because you don't have to be in there cutting preps to make that money anymore. You did it to start with, but you got your hard costs covered. So I'm taking my time value, and I'm putting a value on that time, and I'm getting paid for that value of my time over 60 months, 38 months. The average, I think, across the country is 39 months at an average of 13.9% of this. So that's what we do. But it's a unique opportunity, and it doesn't cost you anything right now. I mean, you could actually start doing loans before, before July 1st.
Yep. Well, do you credit your team with interest or without?
I credit to whatever the payment comes in. So I have the payment, I credit them with the interest and everything. I want them to be on my team helping me build my other business. I don't want them to be upset about me having this other little account. And, if I need to buy something, I'll give you an example. If I want to buy a laser for 80 grand, 90 grand, I got the money over here, I'll buy the laser out of my other account, and then I lease it to the office. So they start spending, so I have cash sitting there. I can lease it and make a few percentage points there too. So it's a neat way of doing business, and it's not something that just happened. This is something that's been around for 10 years. This is not new. We have had people show up here, and here's one more thing I'll say about it. If you see companies out there that say we do the same thing as compassionate finance, and they say, and we guarantee your payments, and we do no credit checks, run. It's a scam. And I've seen them, they call us after, they'll take your money, your setup fees. They'll take that money for a while, for a year, and they'll sign up a lot of people, and then they go. They got the money, they take off. And what I'll tell you is they call us and say, can you take over these loans? We go, no, I don't want your shitty loans. We're not going to do it. And so, because we're not going to guarantee them. How do you guarantee subprime? How do you guarantee that? You can't. And it's BS.
Yeah. The only way there is the interest offsetting the risk, right?
That's right. That's right.
All right. Well, hey, we got to get you to your next media appointment, Dr. Baird. You're a busy man today, walking the red carpet, doing the interviews. But tomorrow, the thriving dentist, Gary Takis, the productive dentist, Bruce Baird, going to be in here for a conversation. If you caught Peter Bolden, if you caught Chris Bowman, if you caught Howard Fran last week, holy moly, that was an hour and a half of just.
Well, Gary is not only a consultant, but he's also a practice owner. And he and I have been friends for a long time. We're going to have a blast tomorrow. So, get on there with us and ask questions, and we're going to be here for you. And I hope everything goes well for you. Stay safe. Let's get back to work. Let's get back to 100% of our previous production. We can help you do that at Productive Dentist Academy for sure. We can also do that through Compassionate Finance and through Abella AR. So thanks again. Thanks for tuning in. We get every week. It's just so many people. So I love it. Thanks again.